I want to return to the department because I think your feed cut out in the process of my original question, and I want to review your answer there a little bit, because we've obviously seemed to have decided to close a centre of excellence in Owenacurra and in Midleton, a centre that is exemplary of fully integrated 24-hour high dependency beds in a local provision setting, which is exactly what we're meant to be aiming towards. There has been, in the time that in the period when the closure decision was made, there was no new information provided on the building that is relevant to the closure. And the building faces no more or less challenges than most of the other healthcare provision facilities in the area. We've decided to move them those 11 people, most of them, 30 kilometres down the road at a cost of 1.25 million into Carrigaline and Glenwood, and we have no planning permission for that building. And just to remind you that our national policy documents state that we should have something in the region of 30 placements in every region. And in East Cork had 24 placements in Owenacurra, it now have 0. For example, and I suppose you can compare, North Cork has almost the same population, 93,000 in 2016, it has 42 placements. And I understand there's a waiting list of local service users for those placements. So I'd like to return to the department. Oh, and I just want to finish by saying, and I think it's actually really important if I have time to read this, the HSE itself has cited a significant conflict of interest, and in their own representations to this committee today, they've written, at a very early point, a potential conflict of interest was declared by a senior manager in the CHO Mental Health Service, as that person had a family connection to this property. And by this property, we're talking about, I know what you're about to say, Chair, and I'm not going to identify anybody.
Yes, I'd ask you to by no by standing orders.
Yeah. Yep. So as that person had a family connection to this property, and by this property we're talking about the Carrigaline property. On the service side, and to ensure that there was, and I'm reading from the HSE's own document, Chair, on the service side, and to ensure that there was no conflict of interest, all matters in relation to the proposed purchase was dealt with by a different senior manager and the chief officer. So I'd like to go back to the department again and ask them, considering that the decision to close Owenacurra is absolutely contrary to our national policy, it's absolutely contrary to the best interests and the wishes of those residents, and it seems to be part of a procurement and decision-making process around capital spending, which I have considerable questions about and which we will be continuing to review and continuing to follow up with this committee. Are you telling me that the department and the minister has no questions about the decision to close Owenacurra?
Deputy, can I just say to you, just in relation to identifying people and allegations that we don't have, that aren't substantiated, and people have been named in the media, I would just ask you that you would desist from that. You know, I know you haven't named anybody.
I haven't named anybody, Chair. And in fairness, the HSE has sent us a document today as part of the PAC briefing, and I've read from their document, so they're not even my words. I understand that,
but I'm asking you not to go any further than that.
Okay. Well, I'd like to hear from the department if they have no questions.
Yeah. Ms. McGurry, you're taking that.
Deputy, sorry, as I was saying, the decision was taken by the HSE to close the facility in response to the Mental Health Commission action, and the building was deemed unsuitable. So I think it's in the interests of the residents that they have suitable accommodation, and that's what I understand all the efforts of the HSE have been directed to.
So, sorry, Chair, I know I'm out of time, but can I just be clear that the department has no concerns about the procurement process, the spending of capital assets where there's no planning permission in place, and the closure of a functioning facility? You have no concerns over that?
I can't say that I don't have any concerns. I'm just looking at this information now. But these are detailed operational decisions that are for the HSE to resolve. And from the briefing note there, and they can speak to the conflict of interest and the other issues that you've raised there. But from a department perspective,
there's no accountability between the department and the HSE for such a decision? Because the department won't hold them to account. Is that what you're telling me?
No, I didn't say that. I said that the department and the minister have been liaising closely with the HSE in relation to their decisions that they're taking in the interests of the residents of Owenacurra. And that's what they've been doing, because the building is unsuitable.
The building is no more unsuitable than all the other buildings in the area. There is absolutely no rhyme or reason for closing Owenacurra and spending huge amounts of money on other congregated settings, which are absolutely in contrast and contradiction to our national policies. If the department won't hold the completely opaque decision-making of the HSE to account, who will?
I don't really understand the question that you're asking me. The HC are here answering the questions about the decisions they've been taking on Owenacurra.
And the answers don't add up. So where's the accountability? Is the department going to hold them to account?
Well, you've expressed your view about how the decisions don't add up. I can say the department and the minister have been following with the HSE the decisions they're taking in order to, in the best interest of the patients and the residents in Owenacurra.
But this is not in their best interest.
Thank you, Deputy.
Well, that's your view, Deputy.
No, well, that is their view. And from a rights-based provision of care, that their view is very important as it happens.
Thank you. Thank you. Okay, so